Hey, y'all, welcome to the Health or High Water podcast. I think we're on episode 143. I'm here with Kara Heckerman, a speech language pathologist, founder of VoiceFit and Align Horizons Therapy. We're going to dive into some amazing things she's doing down in Florida. But first, I know it's ad time. I'm really excited about this partnership with Push Ups for Parkinson's. This is Health or High Water's first nonprofit we get to partner with. All donations of proceeds will go to Push Ups for Parkinson's, that runs a support group and brings awareness to Parkinson's here in the Brunswick or South Brunswick area. The whole idea is you do 10 push-ups, donate $10, post that on social media, help us gain attention and our finances to make sure that we're trying to figure out a end to all this and just be a part of the community. There's about 90,000 people a year that are diagnosed with Parkinson's. I think that's underdiagnosed with numbers there, but my personal opinion. But every little bit helps, and we're trying to spread awareness and making sure that that number drops by a lot. I can't find my words today, y'all. I hope that's not a precursor for what's about to happen here. It's not. It's not. We're great here. But make sure you guys go check out my1010.com and do your part for Parkinson's. Kara, how's it going?
I'm doing great. Thank you so much for inviting me. I'm so excited.
I've been really excited on this because we kind of work in very parallel realms with working with seniors and working with some speech therapy, making sure that we're getting their diaphragms moving and getting breaths going. I saw you on your stuff on, so I think it was Instagram, right?
Yeah, I think when we first connected, it was via Instagram, and I was so drawn to your post because I was starting to follow more influencers that were in this kind of space. And when I saw your videos, I could just see the passion that you had with the people that you work with. And when you reached out to me, I thought, oh my gosh, how exciting. I would love to do this. Yeah, I'm just glad to be here. So thank you for
You're
having me.
welcome. You're welcome. You're welcome. Anyone who's honestly in this area of working with seniors is just kind of like dear to my heart. For everyone who's been listening to the podcast know that I started this because my mom had a stroke turned dementia, and I wanted to build a program that was going to help her move and her actually enjoy it. That had preventive measures. Hey, how does a hinge work? How to make sure we're breathing properly, grip strength, all the things that are going in, and that's what really drew me right to you. As soon as I think you wrote a comment on there. I looked at your stuff. I was like, my gosh, the vocal music, the speech, these things are becoming such like a crucial part about aging and aging healthily. How did you get into all this? What was the catalyst? What got you into this?
Oh my gosh. So I've been a speech language pathologist now since 2012. I started as an assistant and then I went through grad school while working. And then I had my certifications shortly thereafter. So most of my career has been in the world of one on one therapy. And entering the group wellness space has truthfully been new. This happened within the last year. Oh my gosh, it's wild to say that. I want
Nice.
to say the first Voice Fit class that I ever hosted was in January of this year. But it was something that was in my mind, thinking of creating, just wondering how that would look because traditionally speech language pathologists aren't usually in that kind of space. So it was more, how can I make this accessible to people and make this happen and what would that look like? So yeah, my story is a little multifaceted where most of my experience is working as a clinician across the lifespan from pediatrics to adults and nearly every setting I've worked in, from schools to acute care to inpatient rehab, home health, outpatient. So I've kind of done all the different things in our field, and opening my own practice about 2.5 years ago really opened my eyes to just how our field really hasn't been doing much in the world of prevention. And that's something that I wanted to start that discussion with people and to see what that looks like too.
So important. Now for those of y'all listening out there, my mom's stroke affected her throat, her ability to swallow. She does something called pocketing. For those of you who don't know what pocketing is, that she'll just like shovel food in her mouth and it does not get past her cheek and it just gets more and more packed in there. She chokes. Most meals are absolutely miserable for us to go through trying to get her to slow down. She somehow at the same time rapidly eats and doesn't eat at all. It's this crazy middle ground. So what you're doing over at VoiceFit is hyper important to make sure that we prevent these kind of things from happening. And it's so gnarly to see firsthand what's going on. And God bless you for what you do, getting into this space and taking that leap. I know it's not easy by any means at all. And why you got to it's pure. I absolutely love that. So, what does a typical class hold for you? What do you guys do?
So how we typically, I did borrow a lot of elements of group fitness in general, and I know we're kind of backtracking a little bit here, but I would watch. I remember one specific event. I was invited to speak at a local Parkinson's group in Flagler Beach here. I'm located in Florida. And before I was going to speak, there was a local group fitness provider who specializes with Parkinson's. His name's Artie, and he was just very vibrant. And he got on stage, and I just saw the audience and the crowd, their faces just light up, and they were moving their bodies and exercising and laughing. And I thought in my mind, like, this is essentially physical therapy, but people are enjoying it. They're doing it with their peers and they're having fun and it's exciting to them. And that's kind of where I had a light bulb moment of why isn't the field of speech language pathology utilizing this type of format to with our service delivery options? Because like I mentioned, I've worked in all different types of settings. It's usually treating after the illness or the thing has happened. We're rarely in those spaces, like when you mentioned what you're experiencing with your mother after the stroke and the swallowing. What if we entered spaces like that were more accessible to people and we could teach them preventative? There are swallowing exercises that we can do. And in the scope of our practice, when you think of cognition, swallowing, speech, communication, feeding, all these things, what if we talked about it before the injury occurred? And my brain was just spinning with all these ideas, like, and why haven't we done that before? So honestly, I kind of went way past probably what your original question is, but
No, I absolutely love it because you're giving some texture to what the problem is and you getting into it. That's exactly what we're looking for here. That's very very well said because we have a such a downstream issue of not only are our hospitals over full, we have 10 to 1 seniors trying to find a community that's not only has their needs but is in their budget. The VA is overrun with veterans that are trying to get healthy and they're really not being shown the right path because they're not teaching prevention.
yes.
They're very reactive instead of proactive, and this is exactly what I'm getting from you is let's be proactive with these kind of things. Let's do some swallow drills. Let's do some
Yeah.
these kind of things and make sure that we have the strength and not atrophy our vital functions, right? Like breathing and chewing and speaking. And this something I'm sorry, I'm getting so excited here about
No,
talking.
everything you're saying about just really has been ignited in me. And I even pulled up some numbers just because I didn't want to throw out make-believe numbers. But everything that you're saying, like it says 90,000 new Parkinson's diagnoses happen every year. 1.2 million Americans are projected to be living with Parkinson's by 2030. And that 90% of people with Parkinson's develop changes in speech and voice. So and the fact that our population is aging and we do have a healthcare system that's already, I don't want to oversimplify things and say maxed out, but we do have a healthcare system that's just getting all of the issues after they occur. Like, what if we get ahead of this and what if we can help reduce the burden that could be on these systems and improve quality of life for people, and make it less scary, and there's people sitting in the audience at some of these discussions I did that just got a fresh diagnosis, so they're terrified and they're not really experiencing any swallowing or speech or cognitive issues, and then they're hearing it and they didn't even know that this was a part of it. So to then not even knowing that you need to schedule appointments with different people. So there's a lot of lack of education and awareness, and there's a lack of prevention to get there. So there's just this, yeah, there's a lot that needs to change, I think, to to help people in general in this country. And not just with Parkinson's, I think just aging in general.
Well, it's going to take people like you know what I mean? People like you that are like on the front grounds and explaining stuff. And us having this conversation, I think, is a step in that right direction about like what can we do? Well, we got to talk about it, right? What is that issue? Well, now I think we got a pretty good grasp on it. It's a prevention issue that we're not taking care of ourselves properly,
Mhm.
right? And speech is such an important thing about that. And one of the things I teach in my classes is blue zones, right? Like, listen, if they're over 100 years old, they're probably doing something right,
Mhm.
and one of the big things is mentality. A lot of these blue zones people are part of church or they're going to like friends groups every single week and they have to speak, right?
Yes, that accountability. It's funny that you said that because in a voice fit class, maybe a month ago, we brought that up too. And we were talking about blue zones just as we were doing our exercises and the different cultures that do reach, 100 years. And it's not just 100 years of living, it's living, with good quality. And a lot of that is sitting on the ground to have to stand up, climbing stairs. And like you said, that spirituality piece, that community piece, all of that goes into that holistic of what makes a person thrive well beyond like typical life expectancy that we see here in the US. And yeah, voice fit, it just makes me excited because in what you're doing too with the communities that you're with, it's creating that community and something to be a part of that's bigger than just you, and to know that you're not alone going through these things. There's other people with you, and let's not make it as scary. Let's be together and let's do this as a team instead of feeling so alone.
Well, yeah, because there's so many cognition issues. It's Parkinson's is just the tip of the iceberg, like Lewy body dementia, Alzheimer's, vascular dementia. There's like go on and on, about those kind of things. But I want to hear about your classes, like what's the antithesis of the class?
Yeah, that was the first question that I went off.
No, no, cool. No,
Crap,
listen,
I
I love
remember.
it.
Okay, yeah. So a typical voice fit class, I do go over it. I am training professionals to be voice fit instructors now.
Nice.
And what we do is we go through what's called the voice flow. So it's a little acronym to get people comfortable with what it looks like, but not to get all technical. So basically, when you walk in, we have music playing. Sometimes we do different themes, like some fun ones that we've done. We've done a Grease, the musical theme. A recent one we did was Route 66. That was a lot of fun, where we did music, like we're starting at the beginning, which I did not know it started in Chicago and it ends in California. And we did sampled music along the way. And then we did some trivia. We've thrown in kazoos every now and then, but they follow a predictable routine and format where we begin where it's an introduction. This is what we're going over today, just so people know what to expect. It reduces that anxiety when you know the class format, generally speaking. And then after that, we move into, this is for a Parkinson's specific class. We have different formats, whether it be CVA or brain injury. And then, but with Parkinson's, then we move into voice exercises where we sustain ahs, we do glides, we do contrast volume practice where we practice doing affirmations we do often, or other words. Level 1, a whisper; 2, conversation; 3, saying it loud, to get that somatic awareness of producing said volume in your body, because with Parkinson's, volume and that sensory perception tends to be softer. So getting familiar with that. And then from there, the community aspect is where we spend the bulk of our class. So that's where we might throw in some trivia. We might do some breath work, some diaphragmatic breathing, like you mentioned earlier. We might do some swallow exercises. We might, trivia tends to be a fun one. We've done relays before, where we get beach balls and we activate movement paired with voicing, because we know when we're moving the body and using our voice at the same time, we're getting more bang for our buck. And then at the end, we essentially have like a cool down where we're just wrapping up what we went over, why we're doing it. And we always end with group affirmations where I say it, the group repeats it after me. So things like, we're stronger together, just anything to kind of reframe that thinking so it is that positive that positive thinking, and you're also working your voice because you're saying it with a louder volume. And then when you're saying it in unison with a group, it's just a nice way to close it. So it usually is about an hour long, give or take, our classes. It's fun. We have fun.
Well, we'll have to maybe arrange you coming up to our neck of the woods and come and do a class out here with all the communities I work with and see how that goes. I think that'd be fun to
That'd be fun. No, that'd be
outsource.
a lot of fun. And yeah, I'm happy to share any of it. It's been a joy to find the flow and find what works and to experiment with new things. And yeah, it's been fun.
I love that. Real quick word from our sponsors. If you're looking to quantitate or make it really simple to find out what your wellness program needs, is get a genetic test through Geneplanet. Use code APT for premium test for 30% off, and it's going to tell you the right workouts, the right diet, the right supplementation, injury risk and prevention, cardiovascular disease. I could keep going on and on and on. But how much money have you wasted on programs, on diets that haven't really worked? The only way to do this right is to quantify or get scientific research done about you to figure it out because we're all a little bit different. Okay, so use code APT at checkout. Premium test from geneplanet.com to save 30% off genetic tests. It's a one shot done. Once you get it done, you don't have to do it again. It's a one time fee. Go to geneplanet.com. Use code APT for 30% off. I have to go back real quick to something super duper important that you're talking about is affirmations with, especially with
Mhm.
Parkinson's.
Mhm.
Um, Literally this morning, I had a one-on-one because I do some one-on-one boxing sessions with some of my clients, and we were doing some footwork, and it was very new to them, right? And a lot of these seniors I work with, their confidence is shot, right? Like after a diagnosis, like they're not really super excited, and I get it. That's got to be super hard. I can only empathize. I can't really sympathize. I could, you know what I mean? Um, but we were doing some footwork, and she was like, "Tripp, I can't do that." And I was like, "Whoa, whoa, 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 whoa! We are never allowed to say that phrase in front of me ever again." Right? And I was like, can you please tell me one amazing thing about you to me? And she couldn't come up with something. I was heartbroken. I was like, oh
Yeah.
my gosh, you can't think of like one thing that's like you're awesome at or you feel that confident about. So I was like, all right, listen, you got to do some words of affirmation. Every time you say something negative about yourself, it's three times of saying something positive. So thank you so much for
Mhm.
bringing that aspect into these communities, especially with Parkinson's, where it's hard to be mentally there at all times and to be that old version of yourself that's chipper. So I just want to shout out and say thank you.
Well, and to you too, no, 100%. And just being a human in general, I mean, it's hard, you know? We're tuned into so much news and negativity that it's a lot. It's overwhelming. And then especially when you're a human also experiencing something like Parkinson's or what have you, it it is hard. And being able to shift the mindset and to get into that space of I'm trying my best, that self-compassion. One of my favorite things with my first class was seeing these men. I find that it is more difficult for a lot of the men to say things like I show up for myself or I love my, and to see I bring joy. It just them kind of getting even more quiet and kind of hiding during it, and then at the end standing up proud and saying it. That just was to me. I'm like, if I this doesn't go anywhere, getting to see that is exciting to see.
Well, I can't wait to see this explode, and because it's such a heavy need for seniors all across the board. Um, So going into the future, speaking of, what would be like an ideal situation? Would it be like, would you want to go to other communities and teach like lifestyle enrichment directors? Like, what would be a dream for all this?
Oh my gosh, I'm so glad that you said that because I feel like in my brain, before I even had my first voice fit class, I already could see way down the line. So in my brain, I'm like, this could be as big as like a brand that's well known, like a Rocksteady Boxing or an Orange Theory, where there's multiple locations all around the world and people are getting the help that they need and professionals are being trained so that they can implement this in their communities. And to see, because I'm curious, in our field we haven't really had anything that did that prevention. So it makes me wonder, what could the data look like moving forward with people? Like, could this prevent it? We don't know because we haven't done it yet. So my dream would be to have more speech language pathologists getting curious about shifting the service delivery model to be purely treating the ailment, because we're really good at rehab, more so getting good at prevention, education, group wellness. And one thing I didn't even mention too, I know the prevention piece is incredibly important with VoiceFit, is another huge reason why I started this isn't only for the preventative nature, but I ended up kind of not coining, like calling in my own brain, the population, like the people who might fall into that gray area. So with our current healthcare system, that could be people that aren't severe enough for therapy. So they don't qualify, insurance won't cover it. They're on wait lists because there's not enough therapists in their community to serve them. Insurance is denying more visits. Their primary care provider is not sending that referral in time. They finish and they're discharged from therapy, but they still want that accountability in that practice. Or maybe they are in therapy, but they want extra practice and they want community. So it's really, to me, VoiceFit almost is like a safe place to land for all those people that don't fit neatly in our black and white healthcare system, where it's either you qualify or you don't qualify. It's more, okay, well, now there's a space for all these people that don't fit in that black and white criteria, and it's a place where they can be. So yeah, it wasn't only to be preventative, it was also in my brain a place that can be a catch-all for people that need assistance, that don't fit in neatly into the box that our healthcare system has created.
Well, and I think that's the place we need to start, right? Is that high risk demographic of like this, not if this demographic is going to have an issue, it's when.
Mm-hmm.
And
Yeah.
it's going to cost us a lot more if we wait. And this is something I want everyone that's listening right now, hear me out. I understand a gym membership can be upwards of $60 a month for some places. But if I showed you all my mom's medical bill, you would crawl into bed and want
Mm-hmm.
to off yourself. It's
Yeah.
that's astronomical, right? So this is what I want to apply um, here, apply here to voice fit, right? Is why not spend that upfront time to do preventive techniques so you don't have those problems? Because I'll tell you what, a lot of the people that come to my support group or come to our support group for the South Brunswick was never told that there was going to be some kind of voice issue or speech issue with Parkinson's. We're the ones telling them,
And
which is
that's news to them. Yeah. And should it be like that? No, it shouldn't be like that.
it's awkward. You know what I mean?
I
It's really awkward. It's like your doctor didn't tell you that you're probably gonna have some speech issues, maybe some hallucinations. Like you're at a huge fall risk. Like what they don't even tell them that. So it's just it's terrible. So when you're working with Parkinson's patients, especially, what are some things you see vocally that's an issue?
Typical characteristics of Parkinson's tends to be soft volume, and then more mumbled speech, and the articulation tends to be the common characteristics with Parkinson's, and more of a flat affect. And one of the things that we teach with that is it's not necessarily that the muscles required for speech aren't getting weaker necessarily. It's that they're not being used to their fullest capacity. So since we're not pushing it to those limits, that's when the atrophy and the weakness can happen. And this is something that's really big. One of our popular therapy techniques is through Speak Out. You might have heard of that, or LSVT are two of the big common ones. And with Speak Out, a lot of it is talking about shifting from the automatic system. So speech is a fine motor task. We often don't think about that. And so is swallowing, so is walking, and shifting it from automatic to the intentional motor system that's less heavily reliant on dopamine. So being more mindful, being more intentional. We teach saying it like you mean it, say it like it matters. That can help bypass that soft volume, and then doing those contrast drills. So yeah, what we usually see with Parkinson's is that it's very characteristic. I'm sure you've heard it with the soft volume, like I think I'm screaming, but I'm people say they can't hear me. It's a common thing that we can
Well,
work on.
100%. It's the same with bodily movements too. It's why they kind of trip up on themselves and what have you. Is like they think they're taking a gigantic step and it's a small step, and they get caught on the carpet and then they go down. Um, I think that's fascinating though, is that what you're talking about is like that's mind to muscle connection about the voice and the throat. And I tell everyone that comes to the music therapy class, I'm like, we are all born with the same
Mhm.
units here. We can all sing. It's it's just a certain degree. We just have to sing from our guts. And I'm really impressed with how like people really try to sing from the gut, and they actually start like bringing a note like a note together, and they're like, oh my gosh, I can do it.
Yeah.
Do you guys use any singing for voice fit?
We do, yeah, we do
Help
use.
out?
I have a close friend here who's a music therapist, and she is going to go through voice fit as well. And yeah, we do singing. We've done karaoke and kazoos, and we used to always end every class where we do a group song. And we kind of got away from that recently. I need to bring it back. But yes, we do incorporate music, and yeah, it's important and it's fun.
Well, yeah, they just eat it up. You know what I mean? It's crazy. Like they don't know who I am. They don't really remember like what they had that day, but they remember every word to Country Roads.
Yeah, yeah.
It's absolutely fantastic, and I think it's one of the last things that goes. You
It
know,
is. Yeah,
um,
music and in the CVA classes we use elements of melodic intonation therapy, which does use singing. And the idea is if the left hemisphere of the brain, which houses a lot of things we use for language and speaking, is impacted, sometimes activating the right hemisphere with music can help more fluent speech come out in the word finding. So that same idea that you're kind of helping to compensate by using other parts of the brain. And yeah, the singing, it does activate a different, part of our brain. It's beautiful to get to see different ways we can help people.
100%. Um, so do you ever do any like virtual one-on-one work with people?
I do. Right now, most of my one-on-one speech therapy sessions are home health. I'm based in Florida in Daytona Beach, Volusia County area. And I do have a small team of other speech language pathologists that sees people in the area. I am shifting to where I'm going to do more virtual one-on-one and hopefully hire more people here because I am growing and need more speech language pathologists in this area. So hopefully I'll find a perfect fit soon.
Well, maybe they're listening right now.
I know, it would be wonderful. Please apply. So,
But hey, listen, you got to give the podcast a shout out on that application. If
yes,
if you do
yes,
though, okay? Because
yes.
I want to know.
That would be
Um,
wonderful. Yeah, hopefully the next time I talk to you, it'll be about that because that would be fantastic.
and yeah, speaking of, we have to have you back on to see what happens coming forward, and we have to have you come up. Once we get the hammer out those details about how you come up, we'll do a in-person podcast, maybe something live. All of you all that are into this episode can jam out with and come hang out with us. Maybe do a
That would
class,
be
a joint
so much
class or something.
Yeah, that would be so much fun. And I'd love to see what you do with the music end of things because that would be so fun to get to collaborate. And yeah, I like to learn from the fitness people too because I like to pair movement with it. So I'm always like looking at ideas from the people who are more heavy in the fitness part. Like, ooh, okay, how can I add that with what I do and my area of expertise? So it's fun to collaborate and learn from each other.
This is why you're going to go places. This is exactly why you're going to go places. And speaking of, all of you right now that are interested in voice fit and everything that Kara's got going on, go below the episode to the description, click on her Instagram, Facebook, whatever, follow her, please. Support her any way you all can. And if you are looking for a job, apply. Go apply. It sounds like an amazing job. I'll tell you what, I see caring for this demographic is very hard, but you will never ever go to sleep dissatisfied with what you did during the day. And that is something that 99.999% of people will never experience in their life.
It's true. It's true. It's a blessing to get to do it.
Yes, it's hard, but it's worth it. You know what I mean? It's one of the only jobs you go into work and like, oh, someone died again. Like it's like it's crazy, or this person got this diagnosis, or this it's hard, but again, it's really worth it. Last little shout out. You're looking for some healthy snacks. Beef sticks by Bursky Beef Sticks. 10% off. Use code HOHW for 10% off. Healthy snacks for the kids, for yourself. High in protein, vitamin A. Go buy some Bursky Beef Sticks. HOHW. I can't wait to have you back on. Learn more about VoiceFit, what you have going on. And again, all of you all listening right now, please make sure you look out for collaboration between Through Fire and VoiceFit. Maybe we can,
Love
have
it.
some down the road.
I can see
Uh,
it. This will be fun.
we have a lot of these kind of events. Maybe we can fly you up here. I'll
That'd
try
be
to
so
figure
much
out
fun.
something. But I want all the success for you and all the people you work with. God bless you. Keep on doing what you're doing. And everyone listening, please go check out what she's got going on. 5 minutes for you on one of our profiles is means the world to us. So give her the time of day, please. We'll have you back on. Thank you so much all for
Yeah.
joining the Health or High Water podcast.
Thank you. It's joy. Thank you so much.
You're welcome. Till next time. Peace.
Bye.